What I say to families typically who are struggling with the decision around euthanasia, I understand. I'm going to take that idea and I'm just going to set it here on the table. Many families that I've worked with don't yet know at what point watching the suffering of something that they love might change their views on something. And so I offer the gift of that opportunity to you, that I'm not going to judge you if you decide to change your mind on that decision. I respect the decision that you're making right now, and I just need you to know that this is sitting here. You're open. I'm open. If I think that it's important that we have another conversation about that because the burden of symptoms that your animal is experiencing is raising my concerns about their welfare, I'm going to open that conversation again. And likewise, if what you're experiencing as the burdens that your beloved animal is experiencing is causing you to rethink your values around that, it's there. You can open that conversation and we can talk about it again.
It's very difficult for families to find the right time or the right moment. And quite often I'll tell people it's not an actual moment or a time, it's a window. And so, if your pet has been diagnosed with, let's say your cat has kidney disease, for example, the moment that they're diagnosed may just be an incidental finding. And so you're not going to choose euthanasia at that time, even though things will progress. You're not going to choose euthanasia at that time because it's a little too early in that window. I would say that when your cat has not eaten for 4 or 5 days and is lying there and soiling themselves, and you can understand what that looks like, that maybe they have waited a little too long at that point. And so somewhere in the middle is the right time or that right window to choose euthanasia. But the decision is really, really hard for people to make. And so in our service, we use a quality of life scale. We have 14 different categories that people will be able to score their pet in, from appetite, energy and interest, happiness, pain, breathing. So 14 different categories that you give your pet a score from 0 to 5. And it gives you a snapshot of how they're doing at that time. And so depending on the condition of the pet or the disease or the illness trajectory, I recommend people doing it at certain different time intervals. And then you get an idea of where they are and how things are changing and if they're declining and how quickly they're declining.
Helping people make that final decision, particularly when they are uncertain or having doubts as to whether or not it is time. We generally going back to the, what we've discussed before. What did a good day look like for Fluffy, and how many of those things are actually happening now? And the fact that, as we said before, you have done everything possible or everything reasonable. When we know things are not going to get better, what are we waiting for? I often say we are fortunate to be able to make this decision in veterinary medicine. And of course, yes, we're getting there in human medicine, but we do not have to prolong this for him or her. We're really trying to set up a situation where you can be there and there's no stress, there's no distress, a very calm, peaceful process where there's no time limits, for when we're going through the actual euthanasia. We talk about, some people are there for minutes or hours, and it really looks different for everyone. Although people sometimes might think that they will pass on their own. Of course, eventually that would happen, but trying to impress upon them that unfortunately that's usually not a peaceful process. There can be some, distress involved in that, and that's not what we would want for them, of course. And that's often something, that I will say when we're getting to that, and this is not what we want for him any longer. And we don't want to continue this way. And as hard as it is, just remembering that you have been there every step and you've done everything possible. And we unfortunately don't have any other options than to make the very difficult decision, incredibly, overwhelmingly difficult decision to say goodbye.
When it comes to making an end-of-life decision and asking ourselves, it's at the right time, I think sometimes you have to go back to what's the intent of why we make this decision in the first place? Are you making this decision because you don't want your animal around anymore? I'm going to assume the answer is no. So why are you making it? Well, when I ask people that question, generally the answer falls in because I love them and I don't want to see them in pain. Because I love them and I know that I have to be the one to do this. So I come back to the fact that when we make decisions, whether they are life or death, or whether they're sort of the day-to-day decisions, they're all made for the same reason, with intent and care. So sometimes we have to go back to that very root of why we're doing this in the first place. In terms of actually kind of figuring out when it is the right time, it's very important that people are in communication with their veterinary team. Like I said, people, yes, they ultimately have to make the decision themselves, but they don't really make that decision alone. That is what your veterinary team is there for. That's why I'm here. It's to help process this information, allow you to ask questions, and make sure that you have all of the information you need to feel okay with the decision that you're going to make. The right time can depend on a lot of different factors. I also sort of go by the rule of thumb of when a veterinarian says euthanasia is an acceptable option now, we're not in a wrong time anymore.